Oh, come in.
Hi, how are you?
Hi.
My name is Laura Hickson. I'm going to be your nurse today.
Okay.
Let me wash my hands real quick. I'm going to check your name and date of birth if that's okay.
That's fine, darling.
Okay, tell me your name.
I'm Sally Simpson.
And tell me your date of birth.
It's February 2nd, 1950.
Great, thank you so much. And can you tell me if you have any allergies?
Yes, ma'am. I'm allergic to penicillin.
Oh, so what happens when you take penicillin?
Oh, I get the hives and they itch terrible.
Oh, goodness. Okay. When was the last time you've had penicillin?
Oh, that happened when I was just a baby, and my mama told me about that.
Oh, okay. Well, good. I'm glad to that you have that band on, and we also have that acknowledged on your chart that you're allergic to penicillin as well.
Good, thank you.
So, can you tell me what brings you into the hospital today?
Yes, ma'am. I have this spot on my left shoulder, and I just was worried about it, so I figured I better come in.
Okay. So, can you describe that spot to me?
It's just a dark spot. Yeah.
Okay. And when did that start happening?
Oh, about 6 months ago. I
6
think.
months ago?
Give or
Okay.
take a month, yeah.
And just on this left shoulder here?
Yes, ma'am.
Oh, okay. All right. So is that stays painful to you all day long?
It's not painful, but it does sometimes itch and burn sometimes.
Okay. So if you had to measure the severity of that pain on a scale of 0 to 10, 0 being no pain at all and 10 being the worst, where would you rate that?
I'd say maybe a 5 when when it's burning. Yeah.
Okay.
Mhm.
So have you ever had anything like that before, or do you have any painful spot like that anywhere else on your body?
No, ma'am. I think that's the only spot.
Okay.
I don't know if this matters, but I've had to kind of go to the bathroom a lot more over the last year. I don't know if that ties into it, but I just thought I'd
Okay.
let you know.
Yes, absolutely. I think any information is important so we can understand what's going on and how we can help you.
Okay.
So, can you tell me if anything makes it better or worse?
No, ma'am. I don't think so. Mm-mm.
Okay. Well, let's talk about anything else that might be associated with that. Are you having a hard time moving your arm with that discomfort or
No.
anything else? Okay.
No. Nothing.
So we talked a little bit about just maybe that particular symptom, but can we talk about maybe some past history? Do you have any past surgical history or any other history with your skin that might impact your care today?
No, I don't think so.
Nothing else that you've noticed?
No, I have some tingliness in my feet, but I think that's just from getting old. Just tingly
Okay.
and just can't feel my feet as well. So
Well, we're definitely going to look at that when we do your skin assessment.
Okay.
Are you taking any medications?
No, ma'am. I'm lucky. I haven't had to take any medications.
No medications
No?
at all. Okay. So when was your last doctor visit?
I don't remember.
Okay.
I don't remember how long ago that was. I try not to go unless I really something's wrong or worrying
Okay.
me. So
Okay. Well, once we are doing your assessment, then I will report to the physician about our findings, okay?
that sounds fine.
So let's start by just looking at your shoulder. And I'm going to provide for privacy as we're starting to assess your skin.
Thank
Okay.
you. Thank you.
Is this uncomfortable as I'm touching it around the side here?
No.
No?
No.
Okay.
Just the itching and burning sometimes
Yeah.
around that area.
So it's a little asymmetric. The borders here are irregular. Has this mole changed or anything?
It's gotten a little bit darker, and,
Okay.
and I think it's gotten bigger. So that's why it's been worrying me.
Mm-hmm.
So I figured I'd better come in to the doctor.
Any sun exposure, radiation exposure to this area?
I love to garden. That's the only thing I can think of.
Okay. So now we're going to continue with the skin assessment. I'm going to
Okay.
take my gloves off here.
Okay.
Okay, so again, we're going to do your skin assessment. I'm going to start in your face and upper extremities and down into lower extremities. Okay.
Okay.
So you tell me if you have any pain or anything as I'm doing your assessment.
Yes, ma'am.
Okay. So we're going to touch your skin here, your neck. Maybe use your arms here.
Okay.
Any numbness or tingling to your hands here?
Not in my hands. Just,
No?
Just in my feet.
Okay. And so the skin appears consistent and pink, warm and dry throughout, except for that place that we noticed that's really causing you problems. Okay. So now I'm going to go on to your lower extremities.
Okay.
So I'm going to pull back your covers here. It looks like you have some red and spots on your toes there.
Oh, do I?
Yeah.
I can't see that far down there, so.
Have you noticed any numbness, tingling, redness? Is this recent or?
Well, I have the numbness and tingling in my feet. That's been going on the last year or so, but that's the only thing I've noticed.
Okay. So, have you been taking your socks off regularly, washing your feet really good?
Oh, my feet are cold all the time, so
Okay.
I keep socks on almost all the time.
Okay.
And, I mean, they get clean when I shower, but I can't bend down there to scrub them good or anything like that. But they get washed with the water in the shower.
Okay. Well, I'm gonna check your skin for warmth. And it does feel like your legs are a little cooler down here at the feet. Okay. And I'm going to put some gloves on and assess your toes here. So I'm going to touch your toes. Let me know if this is hurting you at all. Okay? So what I'm checking for is to blanch and see the capillary refill here.
Okay, that's fine.
Okay, so they do blanch, so I'm going to do this other one over here. So less than 2 seconds, so that's okay.
Okay.
And I'm going to look at these other toes here. So it looks like the capillary refill is intact to all 10 toes there. But because you may have some little redness places, we want to be sure that we relieve any pressure from that as much as possible, okay?
Okay.
So definitely we'll talk later about making sure you take your socks off and keep these feet clean and dry. But for now, would you mind if I have you roll on your side? I want to look at your back.
Okay.
So we're going to look at for any pressure points that might also be a problem at this point.
Okay.
So let me lay you down here. Okay, can you lay on your side for me?
Okay.
Oh, you're doing good.
Oh, is that
All right.
okay?
That's great. That's great. So I'm definitely going to look here at your shoulders. Any bony prominence is there down the back. I'm going to look at the coccyx here. For any redness, I don't see any redness there. And another super important place is your heels. So make sure that your heels, no redness there noted. Okay, great. All right. Well, this concludes our skin assessment. Is there anything else additional you'd like to add?
No, ma'am, I don't think so.
Okay. I'm going to provide this information to your doctor, and we'll help give him the information so he can follow up with you of what the next steps will be.
Okay.
So here's your call bell here.
Okay.
If you need anything from me, you can just call that, and I will come and help you.
Thank you.
Okay. Hi, Dr. Jones. I just wanted to let you know that Miss Sally Simpson has arrived to the floor, 70-year-old female patient. We have completed her skin assessment, and we have noted that she has a lesion to her left anterior shoulder, 4 by 5 times 2 by 7 centimeters in length. This is new to her over the past 6 months, and she has noted that it has changed and increased in elevation. We also noted on her skin assessment that she has 2 lesions to her big toes on the 2 by 2 on the right toe and a 2 by 1 centimeter on the left toe. These are also new to her. We noted that she has some paresthesia to her lower extremities, which might be contributing to those things. We would like to see if you would like to order anything additional for this patient. Please let us know. Ding.